Okay, this talk is going to be about hormone replacement for men, and we're going to talk about some of the signs, the various symptoms, and some of our solutions for the problems. Okay, first of all, the early signs of deficiency in men. Men tend to gain weight around the waist, specifically around the lower back, the sides, and of course, the waist itself. And when this happens, it causes, believe it or not, a shutdown in testosterone production. Some of that we're going to go into a little bit later into this show, but for now, we'll leave that. Some other signs of deficiency can be moodiness, loss of motivation, loss of libido, depression, and of course, erectile dysfunction. Okay, causes of imbalance. This is where we're going to how weight gain can slow or even stop testosterone production. Okay, the way this happens is when we gain fatty tissues around the waist, we gain an enzyme called aromatase. Aromatase has the ability to convert testosterone into estrogen. Ironically, in a male, we judge, or our bodies judge, how much testosterone we have by the amount of estradiol receptors that are filled in the periphery. This is because we normally convert a certain amount of testosterone to estrogen, and our bodies consider a certain amount occupied as sufficient, and meaning that as long as the hormone profile works the way it's supposed to, it is a good barometer of balance. However, in an obese male or in a male who's just putting on fat, it can actually throw things way out of balance to where a man is most likely to gain more and more fat, because the more fat he gains, the more aromatase he gains, the more the signal is sent that you have plenty of testosterone, and testosterone production therefore shuts down. So this is a huge problem in men, especially middle-aged men or men even as early as 30 on. And this shuts down what's called the hypothalamic pituitary axis, because the hypothalamus interprets the signals from the receptors and tells the pituitary to release what's called luteinizing hormone and follicular stimulating hormone, LH and FSH. So the body can therefore be fooled. And by having just even a little bit of fat gain, we start on a spiral that can go out of control. And as evidence of this, I think everyone will back me up on this, that gaining 5 pounds is one thing, but the next 5 seem to come on faster, the next 5 even faster, and it's a spiral that goes out of control. And the thing about this is even a small fat loss can start the spiral the other way. So it's very important to watch your fat gain and to make sure that you keep your fat balance in check. Okay, some other causes of low testosterone in men. These are some very important ones that are very often overlooked by practitioners. Medications, NSAIDs, meaning ibuprofen, naproxen, ketoprofen. Any of those can cause a complete shutdown in the production of testosterone. Aspirin is included in this. All of those can, including pain medication like opioids, can completely shut down testosterone production. Stress at work, stress at home, any of those anxiety type syndromes can completely shut down testosterone production. And it's a complex mechanism that it does this, but it does involve cortisol, and this can completely hinder testosterone production. Okay, another one. Inadequate caloric intake and or protein intake. If we go on a diet, for instance, and we eat less than 800 calories a day, our body will start to burn its muscle mass and rather than its fat, and therefore it'll save fat tissues because it thinks it's starving. And in these situations, that fat will serve to shut down testosterone production. Okay, the next one. As you've probably caught on by now, all of testosterone production is dependent on a lot of enzyme systems. Well, unfortunately, as we age, these enzyme systems start to shut down dramatically, and that's what's known as andropause, and it's the counterpart of menopause in women. So just by aging, we stop making testosterone the way we should. We don't get enough GnRH from the hypothalamus, which gives us not enough LH from the pituitary, which gives us not enough testosterone from the Leydig cells of the testes, and so on and so forth. Okay, hormone replacement for men. Where do we start and what should we expect? First thing you need to do is get a complete and total panel. And this does not mean for men that you go get your testosterone checked and that's the only thing you check, and if it's low, then you take testosterone and that's it. It's not that simple. We need to check your testosterone level, your free level, your total level. We need to check your DHT, your dihydrotestosterone, and your estradiol. Yes, your estradiol. The reason is in men convert testosterone down two negative pathways, primarily. One is the estrogen one we talked about. The other one is DHT via 5-alpha reductase, and that can be have an adverse effect on the prostate, but it can also have an effect on hair loss. You've often heard of DHT causing hair loss, or that being the hormone that causes hair loss. Well, it does much more than that, but the main thing that we need to do, and one of the main breakdowns that happens in a man as we get older, is these enzyme systems become well-induced. Aromatase becomes well-induced. 5-alpha reductase becomes well-induced. So they readily grab this testosterone and convert it into these negative pathways. So we need to block these. And simply by blocking these pathways, by blocking estradiol, that will fool the body into thinking it does not have enough testosterone and kick in testosterone production. So it's vital that you check your estradiol. In fact, I always say if I had one hormone to check for a man, it would be his estradiol. Other hormones that have a significant impact on men and male behavior are the adrenal hormones, pregnenolone, DHEA, which is another androgen, which can help with lower cholesterol, believe it or not. It can help with mood. It can help with very similar to testosterone in the effect it has on the body. It's a mood enhancer. It helps with dry eye syndrome. There's a million different things it does. Pregnenolone is the mother hormone from which all other hormones are made. It has a dramatic effect on LDL cholesterol, but it also helps with mental acuity. And finally, and this is a big one for both men and women, we need a complete thyroid panel. And the reason I say this is that there's an epidemic of what I call low normal syndrome. You will test any guy, any girl over 30 years old, and they'll come back in the lower 20% of the range and be called normal. Well, I'm sorry, if every single person we test is in the low normal range, there's something wrong. And what is wrong is there's a breakdown of that enzyme system, and everybody with a malady is included in these ranges, and therefore the normal is skewed to the left, or to the lower side of what it should be. So therefore, the other very important fact is that we are not just trying to get you into the quote-unquote normal range. We want you to be in the optimal range, and that's very important when doing hormone replacement for men and for women. As far as thyroid goes, we need to check free T3, free T4, reverse T3, and thyroid antibodies. Your doctor will say, why are you checking reverse T3? Unless you're terminally ill, it won't be low. Or excuse me, it won't be high. Well, I can tell you right now, it's running greater than 1 in 10 that's elevated down here in Florida, and that's because there's a myriad of issues that cause elevated reverse T3. Reverse T3 is basically a useless T3 that blocks receptors for active thyroid hormone to be bound to. So it has the net effect of slowing your thyroid. A lack of selenium will do it. Certain medications will do it. Stress will do it. low-calorie diets will do it. There's a myriad of things that will do it that your doctor doesn't recognize. T3 is never even checked for, and it's the only thyroid hormone. I shouldn't say the only, but it's the hormone that does the majority of work in men and in women. T4, the hormone that's actually produced by the thyroid, is actually, for the most part, useless and must be converted in various other tissues to T3 before it becomes useful. So again, we're dependent on these enzyme systems, and when they break down, we lose out on our thyroid hormone that we desperately need. So it's important to run a complete thyroid panel along with an androgen panel and a complete panel altogether for men. We've touched on this already, but dosing strategy, optimal versus normal. Well, if a normal range for men on, say, thyroid is 2.3 to 4.2, I, for one, do not want to be 2.4. I would like to be 4.0 or above. And what we find is that people function 10 times better when they're in the upper 10 to 20% of a range. And who wants to be normal for an 80-year-old? We all want to be normal for a 25-year-old. That's the point of anti-aging medicine. Anti-aging medicine is a misnomer. It's not that we want to live to 200, it's that we want to live well as long as the time we have on the planet. And we do that by optimizing our hormones. If you look at nature, when animals lose their ability to reproduce, they die. And so essentially what we're doing is we're optimizing hormones and trying to maintain that reproductive state for as long as we can, because that's when we function most optimally. And again, that's a big buzzword we're going to keep touching on, is optimization. And the other thing to realize is when you get these ranges back from these labs, whether it be LabCorp or Quest or what have you, they are all age adjusted. So if we give you tell you you're low in one area and you look at the lab and it says, well, it says that I'm high. Well, you might be high for a 60-year-old, but you're sure not high for a 25-year-old. And if the goal of our therapy is to make you feel younger, we want you to be optimal for a person of a younger age. For men, men are very tough when it comes to hormones because the occurrences are very subtle. Men are not as in tune with their bodies as women are. They do not notice the positive changes like women do. In fact, usually it's the women that notice the difference before the men do in themselves. Men tend to slip back into what was normal for them 10 years ago and don't notice any difference. Usually men will go on it for 2 or 3 months, figure, it's not doing me any good, quit, and then say to themselves, why did I do that, and get back on them. To answer the question, it usually takes about 6 to 8 weeks for men to really start to notice a positive change. Those that do notice, their wives notice it much sooner than that. But then after that, things start getting better. They start losing that weight around, they start gaining muscle, they start having more energy in the gym. Those kind of positive benefits happen. And like I said, most men go through this syndrome where they have to be on them for a while, quit because they think it's not helping, and then go back on. And usually when they go back on, they never go off again. And one of the questions we always get, do I have to stay on these for the rest of my life? The answer to that is no. You have to stay on these for as long as you want to have the benefit of them. And going off of them is not going to damage any hormonal system. You will go back to where you were before you started taking the hormones. It's just the way it works. Finally, what our strategy entails. Testosterone obviously helps with energy, helps with mood, helps with depression, helps with muscle tone, helps with mental acuity, helps with thyroid function. And again, we touched on the strategy of anastrozole and finasteride, blocking the negative pathways of testosterone. The biggest error in hormone replacement for men today is that they just slap some androgel on you, or they inject you with testosterone cypionate, disregarding any of the negative pathways that can occur, and that can be very, very dangerous. Estradiol in men can thicken the blood, can increase viscosity, and increase dramatically the chances of having a cardiovascular event. So it's very important that you block these pathways, that you maintain estradiol level, a low HT level, an optimal testosterone level, and that we maintain your prostate health. We make sure that checkups, we make sure that your DHT, we make sure that your PSA stays within normal limits, and that your free PSA is within normal limits. Pregnenolone and DHEA, there was a Canadian study done that when men supplemented both of those hormones, their LDL went down as much as 80 points, and that's more than any cholesterol medicine on the market that I've ever seen. Mine, personally, and I have the labs to back it up, went from 330 to 110, and that was total cholesterol. Thyroid, we talked about. T3 versus T4. Frankly, I don't care what your T4 is. I care what your T3 is. That's the hormone that does all the work. So in conclusion, for men, hormone replacement isn't just about testosterone. It's about blocking the bad things, optimizing the good things, and staying on top of it, maintaining those labs, doing labs at least twice a year, doing your prostate checks, making sure that your PSA stays within normal ranges. And what we find is when men do this, I can't name a time that a man has ever had a problem, and I've been doing this over 25 years now. So as long as we maintain the labs and we stay on top of the therapy, everything works out great. One comment in closing, I will say this: it's rare for a man to seek out health for himself. Almost 90% of men that come in are dragged in kicking and screaming by their wives. So men, I would love it if you were more proactive in your health, but once we get you, we usually keep you. So if there's any other questions, feel free to get a hold of our staff. We will give you numbers and so on, and ways to get a hold of us in the future. And if you have any questions, let us know. Thank you very much.